Thanks again, everyone, for joining our UTIVA session with Evelyn Hecht. So Evelyn's here joining us from New York, and I am going to just give a quick bio intro to Evelyn, and we're going to jump right into it. The session we have today is more of a Q&A session where I have a number of questions for Evelyn, including questions from the audience, and Evelyn will be answering and providing all the great answers that we're all looking for here.
All right.
So Evelyn is a master clinician of pelvic physical therapy and a certified biopsychosocial chronic pain rehabilitation practitioner. For over 25 years, she's led a team of pelvic physical therapists at her practice in New York City, guiding thousands of men and women towards optimum pelvic health. She recently launched her program PelvicSense, which is an online pelvic healing health program for women, and is working on a program geared towards men as well. In addition, Evelyn developed a robust pelvic health curriculum for both NYU and Stony Brook universities, as well as doing ongoing research in the field of women's health. So without further ado, here's Evelyn. Do you want to say hi, Evelyn?
Hi, it's wonderful to have me here, Derek, and everybody who's in the chat room and participating. Thank you for being here, being brave enough to see what this is about and learn more.
Awesome. Okay, so we're going to jump right into it right here with some questions for Evelyn. So as a bit of an intro, the first question is, can you talk to us a little bit about how you got started in the field of pelvic physical therapy?
Yes, well, I was a young therapist when I worked in a hospital, and throughout my young life, prior to going to physical therapy school, I had lived in various cultures in Lebanon, in Beirut, Lebanon, in Norway, in Brooklyn. And so I was always very curious about, because I saw such differences in the way women were dressing and how they felt about their bodies. And I was always curious about that. And when I became a physical therapist, because I was spoke a few different languages, I was always given the international patients, and they would pretty much ask me without fail about, Evelyn, I can't have sex, it's painful, or I'm leaking so often, or I'm not able to go to the bathroom. How could I even have a baby if my bottom there is so uncomfortable? And I would get a lot of these questions all the time when I was like 21 or 22. And I would ask my colleagues, are you getting these questions? And they would sometimes see international patients as well. And they all looked at me like, I never get these questions. So I thought at that time that, wow, there must be something about me that people feel comfortable asking me these questions. And I thought, well, let me look into this, because we did not learn really much detail about the pelvis outside of, do you have a nerve injury, and are you not functioning there, period. That was it. So I thought, well, there are muscles there are nerves, and we have function just like every other part of the body. So I basically took one of the first courses that was given by an amazing physical therapy practice, and started to practice and try these techniques of healing the pelvis. And to my surprise, they worked and continued to improve their women's and as well as men's lives. So it really started from just this very early stage and has blossomed into a beautiful career of helping thousands of women and men heal pelvic issues.
It's a great intro. Okay, so Nix, can you help define what is pelvic physical therapy and what different types of specific conditions do you treat?
Well, pelvic physical therapy is anything related, say, from your belly button down to the hip region. So we're talking about GI function, going to the bathroom, urination, bowel movements, sexual function, ability to sit without pain. Of course, pain is a very big part of the pelvic floor world. And the diagnoses range from endometriosis, IBS, interstitial cystitis, urinary urgency and frequency, multiple UTIs, dyspareunia vaginismus for men, erectile dysfunction. There's a huge range of diagnoses that really encompass how the pelvic floor, the bottom of the pelvis. So I'm going to show you the pelvis for a moment. So this is the back of the pelvis. So you see, this is your sacrum and the front of the pelvis. This is your iliac crest and your pubic. And then inside the bottom is called the floor, the pelvic floor muscles. And they basically are like a sling that runs from your tailbone, so your coccyx tailbone, and runs all the way to the front, attaching to your pubic bone. And in women, we have 3 openings. One is the rectum, the vagina, and the urethra. And these muscles play a big role in stability, in sexual function, in recognizing when the bladder says you've got to go, but you're not in a bathroom area. So the pelvic floor says, no, you're not ready. So it contracts and prevents you from going. So there's a lot of function that the pelvic floor does to keep your body stable. And the pelvic floor also is involved with your levels of anxiety. You know, there was a cool study done with women where they put various electrodes on parts of their bodies, on their neck area, and shoulders, and pelvic floor region, and inner thigh. And they were shown movies. And anytime there was a scary part of the film, the first group of muscles that went immediately, instantaneously into tension, and when they watched something a little nerve-wracking or they felt stressed, was the pelvic floor. So we're seeing a very strong connection with any kind of stress of life, such as can't pay my mortgage this month, unable to feed and get great food today, or in interactions with loved ones or work-related issues. We live in a world with stress, and that's normal. It's part of what we do, and the pelvic floor will react to that. And so as we go along in our conversation today, we'll talk a little bit about how does the pelvic floor, if it automatically responds to stress, how can we become more aware of its automatic response, and how can we lower its reaction to stress by tightening up, and therefore help to mitigate, lower some of these pelvic floor conditions like I just mentioned.
Mhm. I think that's really interesting how in the study you mentioned that the pelvic floor is actually one of the first areas that respond. So it's definitely an area that is of concern for people to make sure it's functioning properly, right?
Right.
What type of treatment do you see being provided to those who are suffering from urinary tract and pelvic floor dysfunction?
Right. So what we've learned over many years ago, when pelvic physical therapy started, like 25 years ago, a lot of us in the field thought, oh, we have to strengthen these muscles for these muscles to be more healthy. And as we've evolved over time, we recognize, as I just mentioned, that there's a lot of chronic tension, overactivity that these muscles are doing, which can create so many of these symptoms. And so the treatment techniques are, for us as physical therapists, we'll look at and assess, how do your pelvic muscles move? Do they contract well? Do they relax well? That relaxing well is very important, almost double more important than the ability to contract, because can these muscles release its hold? So we have observed the way the pelvic muscle works. So we'll teach people relaxation exercises for the pelvic floor if we do find high tone. We'll also teach stretching. Have you ever learned how to stretch your pelvic floor? Most athletes, you'll learn how to stretch your hamstrings, which is good because they attach onto the back of the pelvis, your quadriceps, but very rarely are we taught how to stretch the area of the pelvic floor. So we'll start teaching stretches to these areas, and then calming techniques. How can we do some mind calming techniques? Because now we've learned that anxiety and stress can automatically create tension in the pelvic floor. So we'll teach mind exercises, breathing techniques. Also strategies like diet. Are you eating a lot of Twinkies and junk food, and not much whole foods? And importantly, the hydration is a big part of that. And of course, if you're sitting in an awkward position for many hours a day and not exercising as simple as a good cardiovascular walking for like 30 minutes, 3 to 5 days a week. These are all simple things that you can do at home to help yourself. So these are the techniques that we'll do as pelvic physical therapists, teaching movement, teaching breath, teaching strategies for bladder. You know, the bladder, I'm talking excitedly because I'm so excited. So the bladder, you know, as children, as babies, we do not have any control over that. And that's because we have to develop the nervous system and muscle function to get control. So when our bladder becomes a little bit more sensitive, or there's always a sense of having to go to the bathroom, even though we just went like 20 minutes ago and we didn't drink like 3 liters of water, so you know it's not full. There are strategies to change the way the bladder is functioning. So we'll do some retraining activities as well. So there's a lot to do.
Hey, those are some great tips. And my next question, I think you answered quite a few of the possible points here. But the next question is, what type of preventative measures have you seen or recommend? And do you have anything more you want to add to that? Or if not, I can always jump to the next one.
Yeah, sure. Well, you're talking about preventative measures for UTIs or just for pelvic issues?
I think for pelvic issues in general, just like pelvic floor pain, or ways to, and I think you were talking about lowering anxiety and stress is actually one of them, for example, or walking. Is there anything else you want to add to that, or we can ask?
Yeah. Well, I'm going to repeat. You know, part of understanding pain is I'll talk about pelvic pain. Is that whenever there's pain, the nervous system and brain, over like the next if you have this for 3 or 4 months, by that third or fourth month, your nervous system and brain has now become super sensitive. We call it central sensitization. And basically what this means is that now the brain and nervous system has become faulty in its constant need to protect you. So any kind of stress or any kind of altercation, whether it be psychological or social, that can also trigger that nervous system that says, uh-oh, something's wrong. There's a threat happening to her. And that goes to the brain. The brain says, oh, something's happening that's wrong. Let me send her signals of distress. So a big part of healing long-standing pelvic pain or long-standing chronic UTI or frequency is to understand I have, without realizing it, and the normal thing that my brain and body will do, I've developed a faulty pattern of hyperprotectiveness. So we teach pain neuroscience to patients. Where does pain come from? Why you may have it? And the most important thing, how to reverse this pattern. And it's, again, can be done easily with some various steps to do at home.
Mm-hmm. It leads right into the next question here is, so with all your experience in the field, can you tell us what you have learned about how the brain, and especially at the amygdala, plays a role in pelvic pain?
So the midbrain, or the amygdala, is our alarm system. And what we've learned in the last 15 years with pain neuroscience is that we have learned that midbrain, the alarm system, is constantly ringing the bells of danger, 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 threat, threat, threat. Typically, the big brain, the executive brain, the one that is called the prefrontal cortex that sits on top of that amygdala region, that usually in a healthy person without chronic pain, that could say to the midbrain, it's okay. She's still safe. You don't have to freak out. I'm overruling your alarm bells. And people with chronic distress, chronic pain, what we've learned is that their prefrontal cortex, that part of the brain, parts of that has atrophied, died, cellular death has occurred. And so it doesn't mean it's forever, I always like to jump in. So basically, if you're having atrophy or death of some of these gray matter brain cells in the prefrontal cortex, then there's no like shutting off the alarm. So part of the work with healing chronic issues is let's bring that prefrontal cortex online. And again, there are lots of great self-help techniques that can be done to increase that and reverse its atrophy.
Sounds good. This is a very practical question here. People probably come to you expecting you to treat them physically. Our viewers are savvy and are listening to how to use their brain. Since we're talking about that, what do you do to help explain to people that both mind and body have a role in healing instead of just one or the other?
Right. So that's a great question. Part of healing any kind of long-standing distress or pain is to incorporate both mind work and body work, because that we are not just body only, and we're not just mind only. We're a combination. One feeds into the other. So if there's been a faulty pattern of, for a lot of women with urgency issues or bladder issues, a constant pattern of I have to go to the bathroom. If I don't go, I'm going to have pain. And so they start running to the bathroom, 15, 30. I mean, I've seen people 25 times a day running to the bathroom, even though the bladder is not full. So that's a pattern where the brain and the body have now gotten into a rhythm that's really not conducive for life, right? So the basic interest is to help you, the patient, learn how to reverse this pattern and do both mind work. So mind work could be like guided body scan or a qigong, tai chi, yoga, meditation, breathing exercises. So there's lots of mind work, although I did mention the three things that incorporate body, which is yoga, qigong, and tai chi. They're both mind and body. But you're doing mind work to really calm that overactive nervous system, to allow the brain to send more of these naturally produced cannabinoids and endorphins, dopamine. We have like a huge medical chest of medicines that are so much stronger than what you would get from a pill. So let's try to get this part of our brain that has it all stuck in the cabinet way in the back. Let's open that door to allow more of these happy chemicals to come out. So we want to train your body and your brain together, your mind and your body together, because one feeds into the other. Does that make sense?
Definitely. It's amazing that like how powerful our body is in itself, isn't it?
Yeah.
Um, what do you do to help people desensitize the nervous system?
Well, the first and simplest thing that you can do is to do a deep diaphragmatic breath, a few of them. So if you're sitting right now, listening to this wonderful interview, notice that how your body feels supported on the chair, that your feet are resting hopefully on the floor, not swinging, they're on the floor, that your back is supported by the chair. And just notice that you have that support. And what you're going to do is you'll inhale. And as you inhale, your stomach, the abdomen region, will slightly puff out. As you inhale, the abdomen region will puff out. And the reason why as you inhale and allowing your abdomen to puff outward is because you want the lungs to fill with more oxygen. So when you inhale and allow your abdomen to puff out, and then as you exhale, you'll allow your abdomen to deflate or to move back towards the spine. And you'll do this for an inhale for a count of 4 seconds. So we'll do that in a moment. Inhale for a count of 4 seconds, and then we'll exhale for a count of 8 seconds. So let's do 2 or 3 of those. So you can sit back. If you'd like to close your eyes, you can do that. So you can place your hands on your lower abdomen, the abdomen region, and allow your hands to gently move outward as you inhale. So ready? You'll take a breath in. 1, 2, 3, 4. And now exhale. 1, 2, 3. You're going to breathe out through your mouth. 5, 6. Push all the air out. 7, 8, then relax for a moment. We'll do that again. You're going to inhale. At the top of the inhale, then you'll exhale. 1 through your mouth, 2, 3, 4, 5, 6, 7, 8. Relax. Just by doing 3 to 5 diaphragmatic breaths is allowing that rest and digest nervous system, the parasympathetic nervous system, to spark up. Most of us are on the sympathetic nervous system, that fight, flight, gotta go, gotta do, hurry up, eat that food, get to my office, what's wrong? We're constantly on this like run mode, which is really activating our sympathetic nervous system. When you breathe deeply, you're asking your parasympathetics to sort of like come up. And the parasympathetic is part of retraining that nervous system to feel that you're safe, that you're calm. So that's one suggestion I do.
I think that's great. Even not even only related to the health of the pelvic floor is just, we do that to ourselves, put us on this busy mindset all the time. So to take a step back and spend 1 minute to like do some breathing techniques can make a big difference in many ways, right?
Absolutely. And what's really, really cool about the diaphragmatic breathing, and sometimes people can feel this better lying on their back, is that as you inhale, so when you breathe in again, your diaphragm is just underneath. I'm going to just bring myself down. So if your diaphragm is sitting right underneath your ribs right here. So when you inhale, the diaphragm lowers. And when you exhale, the diaphragm goes back up to its resting dome position. When the pelvic floor also moves when you do a deep inhale. So when you inhale, I'm going to show it this way. So when you inhale, this pelvic floor region also moves downward, moves out very subtly, not really a lot, but it actually allows for the gentle rhythmic movement of the pelvic diaphragm. And that can also allow the pelvic floor that might be a little bit on high alert, on anxious. That's going to give it a sense of, oh, I can move and I can breathe literally, and be more relaxed, more flexible.
Would you say that from a positioning standpoint, you would recommend sitting or lying down to have the full like benefits of the breathing techniques? Any suggestion there?
Well, the best way to start the motion of feeling the pelvic floor, a lot of people, when they've had issues with chronic UTIs and pelvic pain, it's very hard for people to know where. I have no idea what I'm feeling. So I'll start with them getting into a child's pose position, which is what a child will do. You're on your hands and knees, and you lean back and you sit on your heels. Now, if a lot of us are not used to squatting or really bending that much, so it might feel a little bit tight. So you can put a few pillows right underneath your backside. So you're sitting on some pillows as you roll back onto your heels. Did I make myself? I hope I didn't confuse people. So basically what you're doing is you're in this sitting on your heels, and that widens the pelvic floor area. That actually gives an opening between this whole region as you squat back down in the child's pose position. And then what I'll ask people to do is do a deep breath here and just imagining your pelvic floor widening as you're inhaling. So as you're inhaling, the pelvic floor is opening and widening and softening. And as you exhale, the pelvic floor is returning back to its upward resting dome position. And that's a good start, just to play with the pelvic floor, thinking about it, just even imagining you doing that movement. On a side note about imagination and movement, we have on our brains, in a place called the sensory motor cortex, we have a virtual map of our body on the brain. How else would the body know what's cooking? If they, I mean, we don't, the brain doesn't have a pair of eyes to look everywhere, can't look behind it, can't look underneath your foot. So it doesn't see. It actually has nervous cells, neurons that pick up activities. So even when you imagine yourself, let's say you're imagining yourself going to that child's pose position, and you're imagining yourself inhaling, and you're imagining that pelvic floor widening as you inhale, that also sparks neurons on your sensory motor cortex. So you're getting some activation of that pelvic floor region, even though you haven't done anything, just by imagination, which is amazing. So this is all based on the science of brain MRIs and all, but really good stuff.
It's amazing what we can do for ourselves in many ways with the right training and direction. So just to let everyone know, we have about 3 more questions with Evelyn to get a better sense of, what she can offer and the whole understanding of pelvic floor physical therapy. And then we'll jump right into the questions that we have quite a few questions popping up here and there. So we'll go and ask you the rest of these questions here first. Evelyn, do you use biofeedback? And if so, what kind?
So a pelvic floor physical therapist will sometimes use, as part of their huge amount of care techniques, a biofeedback. Now, what that means, bio is your body, and the word feedback is I'm getting information about my body through this device. So for example, if women are having constant UTIs or pelvic pain, and that we can actually insert a small, maybe like an index size finger, like a little sense, like a tampon. And the tampon size has little metal plates on it that will read your electrical activity of your pelvic floor muscles. So who cares? Well, it's important because you get to see, for example, while I'm at rest, what is my electrical current reading? And when you are at rest, it should be very low, right? You're not activating the muscles, so it should be reading low. And so a lot of people, so a normal resting rate with you at ease, and the tampon type sensor is inserted, and you're comfortable and you're draped, so it's comfortable. A normal resting rate should be about 1 or 2 microvolts, which is, again, the measurement of the electrical activity in this muscle. A lot of women and men with issues will come in with 10, 12, I've seen a few 25 microvolts. That is like holding a 50-pound weight in your arm, like all day long and all night, because that muscle does not give up. So what we do with our patients with biofeedback is we show them, okay, this is your resting rate. Let's see, can we do some techniques, and with the sensor there to lower that high tone. And most people are, as I've noticed in my practice, and most pelvic therapists typically have high toned issues. So we use that to help people learn, oh, this is what it is normally. And when I do this gentle breath technique, or when I do this easy stretch movement, it lowers. And I'm going to do this at home. I may not know what I'm feeling. I don't know if my pelvic floor is changing or anything, but I know that this technique in the office showed me a new way of softening, and I'm going to practice it at home.
And to put that into context, when you're having that high level, does that mean your muscle is in a constant contraction? Is that pretty much what it
100%.
is?
Yeah.
Okay.
Yeah.
No, that's great to know. What happens, and everyone responds differently to certain treatments, and everyone has their own individual timeline in terms of getting better, but what happens when people get upset with themselves if they're not healing? And do you think self-criticism plays a role in pain?
Oh, yeah. Self-criticism is the opposite of self-love. And, I want to talk about, most of us, I don't know, we really haven't learned the value of loving ourselves. Especially with women, we're taught to, cater to the family, do all the, I'm not dissing men. We're, as a culture, I'll just make it as a culture, we're not really, it's not really, it's looked down upon to be to have self-love, or to be selfish. And so the criticism, oh, I'm bad, or I didn't do this well, is a form of chastising yourself. And when you think, when you chastise yourself, or say horrible things about yourself, what do you think your brain does? What do you think? How do you feel? Right? Like you feel tight, like you feel cringy, like you feel bad. And what's happening? It's all those nasty chemicals are flooding your body from the brain. So one of the things I do with really everybody I talk to is to send yourself some love. Maybe look at yourself in the mirror in the morning and look at your eyes, make eye contact with yourself and say, girl, I love you. Or I love you. And it's kind of awkward, but it's a start, because that's going to allow you to feel good. And that's one of the techniques of healing from chronic distress and chronic pain,
Mm-hmm.
to have more feel good moments.
Mm-hmm. Mm-hmm. I see that like quite often, even with people around us, that, you know, if you have a positive mentality, in many ways, it can go a long way in any kind of recovery, right?
Absolutely.
But the other side to look at it is looking down will impede in your ability to get better anyways. So you want to be more positive as much as possible, right?
Absolutely. We're wired, and there's nothing wrong with not being positive if you're not aware of it. But because our brains are wired to remember the scary stuff, because it's wired to protect us.
Mm-hmm.
That's the way we're wired.
Mm-hmm.
So it's not normal for us to be like, yay, because it's not a protective measure.
Mm-hmm.
So it's almost like we have to train ourselves to look for the positive. It's an effort
Mm-hmm.
to look for the positive, because it's not the way that we're wired. But so much research has shown that by forcing yourself to find some of that silver lining, rainbow, pot of gold, positive interaction you may have had just today, even though the rest of the day was crap, something positive to hold on to is what allows your brain to say, oh, I'm going to send more happy chemicals to her.
Mm-hmm.
Yeah, it begets that. So it's a process of practice to be positive.
Thanks for those tips, Evelyn. Okay, we're gonna jump into a few questions now from the audience. Okay.
Yeah.
So this question I'm going to ask you, and you can say if this is something you can answer or not, or what you recommend. What is the best product for acute cystitis and vaginal atrophy due to cancer, type 1 diabetes, and medication?
That's a really good question for a medical physician. That's really not my role. Now, as a pelvic physical therapist, I love doctors, because doctors are going to do the proper medical testing just to make sure there's no growths, there's no cancer, there's no infection. And medicines are needed if there are those diagnoses made. Once the doctor has ruled out there is no underlying medical cause for issues, then it's all about what can you do to help yourself, self-care, diet stuff, movement work, pelvic physical therapist. So that's a great question that really is good to go to the physician.
Okay, thank you. Another question here. I have tried pelvic floor therapy, but found it to be too painful to continue. Do you have any advice?
Yes. The pelvic physical therapist that person may have attended may not have been, I'm not saying she's bad at all, but her knowledge point about how the brain and nervous system works isn't in her tools of healing yet. It's not pelvic physical therapy. And I'll be honest with you, when I first started pelvic physical therapy, I thought we had to do all that. Let's break through the restrictions. Let's push through it. I've learned now that I understand about how the brain and body works and nervous system works. there is no reason to create pain because you're already you're already in pain. I'm not going to add to the nervous system and brain to even more, to rev up even more. And when the nervous system and brain is revved up, they will send pain signals, and they're going to tell these muscles to tighten, to guard. So there's no way that my digging in literally into the tissues is going to make a difference for that. So my work in understanding the biopsychosocial approach to healing has opened the doors since I learned it about 10 years ago. For example, I used to treat patients that out of all 100% of my patients, before I knew the biopsychosocial approach to healing, which is a mind, body, understanding pain, neuroscience, educating people about how the nervous system works. Before I knew that, maybe 65% of my patients got better. And I always felt, why? Why would 65 only? Why? And listen, I'm not perfect. And I know life is not always 100%, but why weren't more than 65% getting better? And once I incorporated teaching patients about how does the brain and nervous system are involved with this situation, and how can you retrain yourself at home and with my guidance, then I saw closer to 85-90% patients achieve better healing. Mm-hmm. So it's I think you just saw a young, not knowledgeable yet about the biopsychosocial aspect of healing. Mm-hmm.
That's a great answer. And in our discussions with many pelvic floor physiotherapists, the connection between the brain hasn't really come up. So I think it's just, you have to find those that are specialized in it, like yourself.
Yes.
I have a question here. I was referred to a pelvic floor specialist due to getting recurrent UTIs. Can pelvic floor therapy stop UTIs? Do UTIs cause pelvic floor problems, or does pelvic floor issues cause UTIs?
Okay, so this is segues into why the brain and nervous system, understanding how they work, is very much part of healing. Of course, you want to make sure if you're having symptoms that it is not an active infection. However, if it's not an active infection, what's going on? Well, the nervous system works directly with our immune system. I haven't mentioned the immune system because they are all integrated together. When the nervous system and immune system are what's called sensitized, hypersensitive, the brain is like a helicopter parent hovering. Okay, I got to protect her any way I can. So what a person may end up with this inflammation, with this system being a little bit too sensitive, is that there might be some inflammation. So therefore you might start to feel that frequency, need to go to the bathroom, bladder discomfort and pain. Any other pelvic floor issues that you might be experiencing, like constipation, sexual pain. So does one create the other? Are they working in unison? Understanding that if there's a sensitized nervous system and there's a overly hyperprotective method that your brain is doing, then pelvic floor physical therapy will address both, and therefore it can reduce and decrease the frequency of your symptoms of UTI, even though you don't have an infection.
Okay, thank you for that. This question is a bit of a segue from what you're talking about, but why does sex hurt years after I had my baby, and before the baby, it didn't hurt?
Well, carrying a baby is putting a huge amount of pressure on your pelvic floor. And whether you had a vaginal delivery or C-section, you had a trauma to these tissues. So, but the thing is that tissues heal 8 to 16 weeks. They've all knitted up, healed up. So why do you still have pain? Is because your nervous system and brain has become hypersensitive. And there are ways to desensitize and reduce that pain with sex. Now, of course, anytime a woman tells me they have pain with sex, I'm always going to ask them, have you gone to your gynecologist to have them look at your hormone levels, right? Hormones can affect your tissue elasticity, your mood, anxiety. So I want to make sure that they've gotten a good hormone assessment by their physicians, and to rule out active vulvodynia. So there are other things to be looking at with a great physician. And then the pelvic physical therapist can really help you become more, to help you heal from this.
All right, I have a question here about, actually there's two questions, more about positioning and advice based on some of the exercises you were recommending.
Mm-hmm.
So the first one is I've had a double knee replacement and can no longer go into child's pose.
Okay.
Is there another way you can suggest to help open up the pelvic region?
Absolutely. That's a great question. I was going to mention that, but I got sidetracked. So yes, there are people that just can't bend that way. So lie on your back. Basically, it's called a happy baby pose. And you will bring up one knee towards your chest, other knee towards the chest, and then you bring your legs slightly out to the side, each side, and you support your thighs with your hands. Your calves and your legs are resting. So your thighs are resting, and then you can do that same inhalation, expanding the pelvic floor. Exhalation, it softens and returns to its upward resting dome position. So the happy baby pose is a great way. Did I answer all the question?
No, thank you.
You did.
So there's another one on this. When doing child's pose, diaphragmatic breathing, do I sit on my heels so your back is upright, or is my face on the floor so my back is horizontal? Like
I
what
love
part
that.
of child's pose?
Love it.
Yeah.
Yes, the back is horizontal. So you're really, what you want to do is get a folded towel or two, or pillow, depending on how, to allow your head to be resting on that pillow on the floor. And your knees are wide. It's a wide knee child's pose because you want your belly to be able to fill, right? If your knees are too close together, then when you inhale, there's no room because your knees are there. So get your thighs out to the side, and your head resting on a pillow or folded towel. And your arms can be by your sides or even up in front of you, depending on how you like it. Thank you for asking.
Okay, we've gone through some of the live questions here. I have another one here. Does being postmenopausal make you more likely to have pelvic floor dysfunction?
So postmenopausal basically means that you've been through menopause, and in the buildup of menopause, called perimenopause, that's when you have starting to lose. Initially during menopause, you lose progesterone, a lot of it, which can lead to some of the symptoms of anxiety and irritation and brain fog. And then you hit menopause one day, and at that point, you're now even losing estrogen. And estrogen is the hormone that keeps those tissues fluffy and thicker. So when you've hit menopause and now you're in that postmenopausal period for the rest of your life, you've lost a lot of estrogen. So estrogen is, obviously you need to speak, this is something you need to talk with your doctor about it, but estrogen can keep the tissues more lubricated, thicker. So if you have gone through menopause, postmenopause, your muscles of the pelvic floor and the vaginal tissues are thinner. And with age, unless you have really done good strengthening and relaxation to the pelvic floor, you've also lost muscle mass. Yeah. So that combination can lead to, a combination of different symptoms.
Thank you for that. All right. I have two more questions. Okay. This one just came in. When it comes to UTI prevention, which is how I came to learn of Utiva, how do natural supplements play a role in your recommendation within your pelvic floor physio advice?
Yes. Well, I always like my patients to see a great a doctor that knows about hormones. I think, and a person that knows about hormones is also going to learn about natural remedies as well. So I feel like I'm not in a place where I can counsel on these, like make sure you're eating ginger extract, or you're taking, pumpkin seed extract. Like that's something that's not really in my knowledge, that deep knowledge point. And I feel it's more a good hormone or functional medicine doctor can really address that well. But I'd like to make sure that you're looking at that, because there is such a shift in with our hormones, which can create some of these symptoms. Did I answer that question? I feel like it kind of flew off that a little bit, but that's okay.
It's okay. No, I mean, I think that as you mentioned, like it's good to consult with a doctor for, if you're looking at hormonal therapies or natural products for prevention as well.
Absolutely. And the other, as I mentioned before, make sure you're eating whole foods. You're not eating processed foods. Like you're not eating a lot of bread as processed food. You're eating food that is grown right from your neighborhood, environment, and that you cook, you put together, versus buying canned stuff and frozen stuff. That's fun here and there, of course. Junk food, yeah, here and there, but make sure your body is really getting those good guts, microbiomes. That's what they're called. Mm-hmm.
Sounds good. So Evelyn, this the last question is me just coming back to you. Uh, can you tell us a little bit about this promotion that you might be having for any of the participants here, or for the YouTube?
Yeah. So as a pelvic physical therapist for over 20, almost 25 years, one of the things I noticed was from my physicians, they would say to me, I'm referring you all these XYZ people, numbers of people, but these patients would not go to a pelvic physical therapist. And one of it was because of cost, because they can't travel to and from a pelvic physical therapy, or if they, in the city, there might be a long waiting list, or in rural areas, there weren't any pelvic therapists. And I would constantly go on to, I like to give advice onto the various Facebook groups, like vulvar vestibulitis and pelvic floor dysfunction. And there are so many sad stories of loss of hope. I don't know what to do. It's too expensive to get help. And they just look like, really feeling left out. So I wanted to develop a program, which I did. It's called PelvicSense. And PelvicSense is a daily guided home healing pelvic program. Basically, it's a pelvic healing program that you can do online in the privacy of your home. And it's a biopsychosocial approach. It's going to teach you pain neuroscience education, the evidence of all the healing techniques, like sleep. That's a healing technique. Breathing. What's the science of stretching? How do I get back to doing some of my meaningful life activities? So PelvicSense is a program I designed because I wanted to reach more women, and I'm going to get one for men. I wanted to reach more people who couldn't find or afford an amazing pelvic physical therapist and learn what they can do at home. So it really puts the healing and the control of healing in your hands. So what I'm offering this amazing group is 20% off my program. It's a 3-month program. It's written for a month, but most women do it for 3 months because it's important to repeat things, and they may not have time to get to it 3 or 4 times a week. So it gives that amount of time of practice. You're practicing mind exercises, a gentle video series of body exercises, and lots of learn modules about the science of healing, which gives one control. I have control over my breath. I have control over when I go to sleep, versus I'm out of control because I'm so uncomfortable and distressed. So I'm offering 20% discount for the full program. The program typically costs between $99 for a silver to $229 for the gold offer. I'm offering 20% off of all the 2 offers I have for up until April the 10th. So you can get those 3 months, but please get your program using the, what's that called? The coupon called My Pelvis. That's MYPELVIS. my pelvis, and I'll go onto my website at pelvicsense.com to get that.
Awesome. Hey, Evelyn, thanks for sharing that. Some of you might see, Kim is also posting this note in our group chat. So all of you can look in the group chat. Evelyn's program, pelvicsense.com. The link is right there as well. And the code is right there as well in the chat. I want to thank Evelyn for her time, for joining us. One last one last thing to note is on the Utiva site, just for a limited time until March 29th, we're having a 50% discount on some of our new products that we recently launched. It's a limited time offer, so do take a chance to visit us on the Utiva site as well. I mean, most of you are already customers of Utiva, so we appreciate your support. As for that, this will conclude our current session. The session was recorded and we will share it a bit later on, and Evelyn will share the link with you as well to share with your audience.
Awesome. Thank you so much for having me here. I hope everybody learned a little something. It was always great to share information, and feel free to talk amongst yourselves. Talk to your friends about pelvic issues, because you'll unearth a lot of, I have this too. And that's also about, what Utiva wants to do is to spread the word out. Don't keep it hidden. Get some help. I love the Utiva brand. I'm so happy to be part of this company, and I hope you continue to do well.
Thanks, Evelyn. And thanks everyone for joining. Have a good evening.
Bye.